This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools. This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools. This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools. This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools. This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
All right. Well, welcome everybody. Thanks for being with us. My name is James Barragán. I'm a politics reporter for the Texas Tribune. Thank you all for joining us in person and online for our conversations on what the state should be doing about fentanyl and opioid overdose deaths. It's so nice to have these events in person again after COVID. You kind of sort of forget how awesome it is to have these conversations in person. And it just really is a treat to have experts, have lawmakers come in, and also to be able to share this with members and with the members of the public. We want to thank today's sponsors. Our major sponsors include Community Medical Services, Raise Your Hand Texas, and DHR Health. Through corporate sponsors and donors, corporate sponsors and donors underwrite this event, but they play no role in determining the content, speakers, or line of questioning. Before we begin, I want to take a moment to thank our Texas Tribune members joining us in person and online today. We're grateful for your support. If you value events like this, which we all do because we're all here, and you're not yet a member, please consider supporting the Tribune. Head to texastribune.org/donate. A couple of quick housekeeping notes. We're going to have about 45 minutes of Q&A. With us and our panelists here, and then we'll have about 15 minutes for audience questions. And we've got, it looks like we've got mics here, and we'll point these back out again when we get closer to time. If you'd like to tweet from this event, please use the hashtag TT events. Again, that's hashtag TT events. And without further ado, let's sort of get into it. And first, I'd like to introduce directly from my right to left, we'll go. State Representative Tom Oliverson, a Cypress Republican who chairs the House Committee on Insurance and also serves on the Public Health and Healthcare Reform Select Committees. Additionally, Dr. Oliverson was selected to be the Vice Chair of the House Republican Caucus. To his left is Cate Graziani. She's the Executive Director of Texas Harm Reduction Alliance. Over the last 4 years, Graziani has worked to build a statewide organization rooted in harm reduction values, which if you're not familiar with, we'll talk about what harm reduction is and why it's important in this discussion. Before the Alliance, Graziani worked at grassroots leadership on the criminal justice team for 4 years, working for alternatives to arrest and incarceration. And to her left is State Representative James Talarico, Austin Democrat. He's a former public school teacher and education nonprofit leader who was first elected to the Texas House of Representatives in 2018. He currently serves on the Public Education Committee, Juvenile Justice and Family Issues Committee, and the Calendars Committee. Whew, long resumes. All right, let's get started right away. And I guess I want to start off by acknowledging something that happened to, I think, Cate Graziani for the last 4 years has been at Texas Harm Reduction Alliance, recently announced that she will be soon stepping down, I think, from her position there. And I guess it's a good opportunity to start this conversation. You've done, I think, so much education about harm reduction, educating knuckleheaded reporters like me about the subject. And so if you could start off the conversation, I guess, by talking about the last 4 years at the Harm Reduction Alliance and what has changed in the conversation in Texas around opioid overdose deaths in that conversation. What has changed, what you still hope to see change? Because it seems like we're making progress. There's new legislation filed by some of our representatives here that is important and is moving, but still a lot of legislation that I think you would like to see that isn't moving.
Wow, okay.
Just setting you up here,
Thank you, James, for that question. Happy to kick us off. I'm Kate, good to see you all here. So first, what is harm reduction? Let's start there really quick. And a lot of people talk about it as a way to work with people who are using substances and to meet them where they're at. But it's really deeper than that. And it's a simple idea that people who use drugs, no matter how much money or privilege they have, still deserve dignity, respect, and love. And so that is the basic value embedded in all that we do at the Texas Harm Reduction Alliance. we were founded 4 years ago in the face of an increase in overdose deaths in our community and the lack of harm reduction infrastructure across Texas and in Austin. That's still true today. And so although we are seeing an increased awareness about this issue, about overdose deaths, about fentanyl, we are seeing the kind of age-old punitive strategies taking precedent over the evidence-based public health and harm reduction strategies that we really need right now. So harm reduction in its most comprehensive form is still illegal in the state of Texas. We have one legal pilot program in Bexar County that's doing incredible work at Corazon Ministries, but we need programs like that around the state. And unfortunately, the bill that would authorize harm reduction programs around the state is likely not going to pass even the House for the first time in 3 sessions. We've passed it through the House each time. So we're actually moving backwards in some areas, unfortunately, and those are the areas that would have the biggest impact on overdose deaths right now. So we can get more into the details around some of the other pieces of legislation, but I just feel like I need to name that it's really hard to work in harm reduction because our state doesn't support it and isn't investing in it, isn't authorizing it, and we're facing an uphill battle when it comes to overdose deaths because of that.
Well, Representative Oliverson, we'll go to you because you got final approval from the House today on an important bill to decriminalize fentanyl test strips, which would help people identify if the drug they are about to use has been mixed with fentanyl, which is a huge contributor to the opioid overdose deaths that we've been seeing across the country and specifically here in Texas. I think the issue maybe has flown under the radar a lot here in Texas, partly because we don't have adequate reporting here in the state. But if you can talk, I've written in a lot of my stories that the usual state leadership, which has been Republican for 20 years, is a sort of tough on crime approach. But this session, it's been a little bit different. And there's still a sort of tough on crime approach, but bills like yours that are tackling it from a public health perspective, looking at, hey, how can we make sure that these people just don't die? Mm-hmm. How did this come on your radar? How did it become a major issue that you wanted to work on?
James, I appreciate the question. You said a lot. So let me just begin by saying that I think that what makes fentanyl different in some respects and what has sort of shifted this conversation is unique to fentanyl itself. As a board-certified anesthesiologist, I'm probably the only person in the Capitol who can claim safe, legal usage of fentanyl for my patients with no deaths of any kind for the last 30 years. This is not a new drug. This drug has been around for 50 years. What is new is using fentanyl as a drug of abuse. And I think the reasons for that are pretty clear. Fentanyl is an extremely potent drug. It is 100 times stronger than morphine and about 20 times stronger than heroin. And so it is an extremely hard drug to use and abuse because the amount that's needed to produce a high but not stop a person from breathing is a fraction, I mean a tiny fraction of the amount of drug that would be necessary if you were using morphine or heroin or OxyContin or something like that. And so what you used to see traditionally is that the only people who ever had a fentanyl addiction were typically nurses and doctors, and that was because they had access to syringes and highly, had the means to actually dilute and measure out and dilute the medication precisely and to abuse it. And still, I will tell you as an anesthesiologist, I think everybody knows somebody in the medical community who either almost died from a fentanyl overdose or did die from a fentanyl overdose as a licensed healthcare provider. So it's an extremely dangerous drug. And especially when you think about this, one of the things that makes fentanyl very unique as a drug of abuse in the current epidemic that we're in is that the vast majority of people who come into contact with it, who use it as a drug of abuse, do not realize that that's what they're consuming. They're told that it's hydrocodone, they're told that it's Xanax, they're told that it's a party drug, they're told that it's something to help them sleep. And instead, it's this incredibly potent, incredibly dangerous narcotic that is essentially just doing what it is in its nature to do. I hear people talk about fentanyl as a poison, and I do think that there's a certain truth to the idea of poisoning, but the reality is that you're not getting bad fentanyl. You're getting a drug that was designed to treat pain during major surgeries like open heart surgery, where the need for profound pain relief in somebody who was on a ventilator in an operating room was acute, short in duration, but incredibly intense. And so that's what it was designed to do. It is not a good drug of abuse. And so I think what you see is there's been a recognition, I think, nationwide on both sides of the aisle recently that this drug really is sort of the exception of exceptions. It's a drug that really, it'll kill you in at least 50% of the circumstances that you come in contact with it the first time you use it. You get no second chances. As I like to say, there's a lot that we can do to help people who may find themselves in the grips of a drug addiction. There's a lot of tools that we can have available to help you recover from that, to minimize the risk of other issues that you might come across as a result of your drug use. But what we can't help you with is death. If the first time you come in contact with a drug that you thought was Xanax is actually fentanyl, and it stops you from breathing literally within 3 to 5 minutes of you ingesting that pill for a long enough period of time that your heart stops beating and your brain dies, I mean, there is no coming back from that. And so I think when you talk to the families of the victims, you hear time and time again that we had no idea, they had no idea that this is what they came in contact with. So it's really like sort of stepping into a field where, you're like an Indiana Jones movie. The next thing that you step on could be the thing that just brings the roof down on your head, and you have no warning whatsoever.
And we'll want to talk a little bit more about your bill, because
Sure.
it's a key piece of legislation, I think, this session. But want to go to Representative Talarico and ask you a little bit about how you came to get involved on this issue. You've worked on similar legislation, and how did you come to start working on this?
Yeah, well, first, honored to be here with all of you, and thankful that you're all here and you care about this issue, and honored to be here with our panelists. This is, I guess, the second time Dr. Oliverson and I have teamed up. Last regular session, we capped insulin copays in the state of Texas for the first time. And so he and I have a history of working together, and I filed a bill similar to his on fentanyl test strips, and so we decided to team up and not just worry about test strips, which we passed today, but also trying to get Narcan, which is the antagonist that can reverse the effects of a fentanyl overdose in our public schools where it's needed most. And that's a bill we're hoping to get on the House floor in the next couple weeks. It's already been passed out of the Public Education Committee unanimously. And so I want to acknowledge that this is a bipartisan issue, and Dr. Oliverson mentioned that. We can't afford for this fentanyl crisis to become politicized and for it to get caught up in partisan politics. He and I both sat on a panel with Governor Abbott last week with parents who have lost their children from fentanyl overdoses. And we need immediate action. Our state is in the grips of a fentanyl crisis. 1,600 Texans died last year. That was a 400% increase from the year before. And I am not a doctor like Dr. Oliverson, and so I'm coming at this more from an educator's perspective. And we know that kids in particular are vulnerable to fentanyl. And oftentimes, it was mentioned that you may be taking a pill and not knowing that it's laced with fentanyl, and that's true. Sometimes a child at a school may pick up something off the ground that looks like candy, and in fact, it's a pill laced with fentanyl, not even intending to take a pill. And so some of you may remember that we had a 13-year-old boy in Carrollton ISD last week who overdosed from fentanyl, but that school happened to have Narcan on campus, and we're able to administer it to that child, and he is still with us. And so I just want to echo what Dr. Oliverson said. We have an addiction crisis in this state and this country, and we need to address that. and all of us have loved ones who struggle with addiction, whether it's a family member, whether it's a friend, whether it's a neighbor. Those folks can't get treatment if they're not here. And so the goal of our bills, my bill on Narcan in school, Dr. Oliverson's bill on test strips, is to keep folks here with us so they can get the treatment they need.
And I think those are important. There's important pieces of legislation. Like I say, that there's been a major focus on naloxone, which the more generic drug name I think is Narcan, of the product name. Although there are different kinds of ways to distribute naloxone, obviously. But so I guess one of the things that I want to talk about is there's a lot of emphasis on Narcan. And you know, bringing people back, which is great. It's a life-saving drug. Other types of naloxone, other ways to get naloxone into the body. That's just one product. But I guess I'll go to you, Kate. What are some other things that we need to be doing as a state in order to really tackle this issue? Because it seems like Narcan, you know, we can talk about it. It's an easy lift. I think politically is an easy lift given the circumstances we're in. But what are other things that we ought to be doing as a state from a public health perspective to try to really tackle this issue? Like, is it education? Is it, you know, what is it? You know, that's part of, like, I think what you all are doing as well, education as state representatives.
Yes, absolutely. Education is a big part of it at all levels, all ages. However, we need information that's rooted in science and rooted in evidence. So, you know, steering clear from abstinence-based education. We know that that is not going to help young people, old people stay alive and get connected to treatment. We need to let people know that they should be testing their drugs, right? So that's a preventative measure, and that's why we're in support of Representative Oliverson's bill to legalize fentanyl testing strips. But we need testing tools beyond just fentanyl testing strips. We're seeing other adulterants enter the drug supply, which is what happens when you have an illicit drug supply, right? So by prohibiting drugs and making them illegal, they become more dangerous. That's why we have our fentanyl overdose crisis currently. And if policy goes after fentanyl, then the drug supply will evolve and we'll have other adulterants and other types of drugs killing people. And fentanyl testing strips won't help us with those. We needed these strips many, many years ago, and because the legislature meets so only every other year, we'll have to come back in 2 years and 2 years after that, trying to chip away and bring more prevention tools to communities. So we'd like to see drug checking be really looked at for the evidence that's behind it and what it can do to help people stay educated about what's in the drug supply, that they need to be using slowly, never use alone. There's a lot of harm reduction tips that can keep people alive that need to be included in this education that I was mentioning earlier. One of the ways that COVID has, you know, contributed to the overdose crisis is that there's more isolation, more, you know, mental health and substance use challenges associated with that, and more people using alone. There's a hotline that folks can call while they're using, if they are alone, that can monitor their responsiveness and potentially call for life-saving support. We're not sharing that information widely with everyone, and it should be accessible. So there's lots of harm reduction tools that will help fight this overdose crisis and keep people alive, but a lot of it is being limited or restricted, underfunded, and many of our experts, we have incredible experts in harm reduction in Texas, and they are afraid to speak up right now because they don't want to be in conflict with state leadership. I mean, we have academics,
Experts
researchers.
are at public universities.
Yes.
Yeah.
You'll notice in many of the hearings where you know, both of y'all's bills have been heard and others that are really important, they're not there. Because they know what the research shows and what we need to do about overdoses, and they're afraid to speak up. And so we need to make room. You know, we need a culture in Texas where this evidence around how to effectively address overdoses is being listened to and appreciated and funded, instead of, you know, silencing folks or making people feel afraid to speak out and talk about what we really need right now.
Representative Oliverson, Kate just talked about you know, the need for harm reduction and the need to decriminalize things like test strips, for example, that are labeled right now as drug paraphernalia. That's been traditionally a no-go among the GOP. You have gotten there on fentanyl test strips. As someone who has gotten there, can you walk us through sort of your thinking on that, and why not expand it to more drugs? Because it does seem that, you know, this is, from talking to the experts that Kate is talking about, it does seem, you know, this is a repeat of the things that we've seen in the war on drugs, where if we keep going after one drug at a time, you know, there was cocaine, heroin. If we keep going one drug at a time, there's going to be another drug. Now we're hearing a lot about tranq, xylazine, being in the fentanyl, right? So I guess if you can walk us through how you got there and your thinking on it, because you are a voice here that's saying, hey, this is a problem, and it's not something that traditionally among Republicans has been a popular position. But yourself and the governor has come out in favor of this.
Yeah, and in fact, actually, the governor got there before I did. I mean, he was very out in front on this issue, and admitted that, you know, his thinking had evolved on this, but he saw how, with respect to the fentanyl, it was incredibly important. Now, look, I don't want to paint an overly rosy picture with respect to all types of harm reduction and all of the different things that are out there. I want to be clear that I think that fentanyl itself is a fairly unique nexus for policymakers because of its potency, because of its narrow therapeutic index, because of the fact that the vast majority of people who are taking it don't realize they're taking it, and the tiniest amount of dosage that you're offering, if you think about the conditions in which traditionally people use this drug versus how it's being used now, you can see very clearly with the lack of the ability to measure precisely and dilute in a sterile environment, and you know, you can see why the number of deaths has just skyrocketed. This is an incredibly dangerous, probably the most dangerous drug of abuse in the history of mankind, I would argue, just because of its potency. So I think with respect to the test strips, then the issue becomes with fentanyl. I mean, everybody should, just as an exercise, take out your phone and go to your Amazon app, and if you put in fentanyl test strips, you can find that you can get a box of like 10 for $20, but as soon as you put in a zip code here in Texas, it'll say, sorry, can't ship this to your location. So these things are easily accessible, very inexpensive, will absolutely save lives. Now, with respect to the xylazine question, we actually have more vets in the Texas House than we have doctors, believe it or not. I think it's like a 2-to-1 ratio almost, James. And they all, I looked for myself to try to find some readily available manufactured test strips for tranq, for xylazine, and then conferred with my vets, and we couldn't find anything like that. So the other piece of the fentanyl puzzle that makes it so unique from this harm reduction perspective is that the material is already out there, and not only is it out there, but you could get a box of 10 life-saving opportunities for $20. I mean, so it's cheap. It can be shipped discreetly to your house. It's readily available. I couldn't find that for some of the other drugs that we talked about. We did hear testimony on that, and I want you to know it's not for lack of trying, but it just doesn't exist. So if it were out there, if it were as accessible as the fentanyl test strips, if it were the situation where the drug had that narrow window where it was more likely to kill you than get you high in any given day, it would probably be a different conversation. And I think, with all due respect to all of the folks that are in here and the different viewpoints that may be expressed, I don't want to give you the false impression that conservative Republicans are for every type of harm reduction that exists out there. So, but I do think, to Representative Talarico's point, with the fentanyl crisis, we are at a very, very good nexus of bipartisanship, and Governor Abbott is leading on that. I mean, to Representative Talarico's point, I mean, he is out in front on this. He just now announced a massive education campaign to try to help educate folks about the dangers of fentanyl. We've talked about Representative Talarico's bills. There are other bills, measures that were put into the budget by Representative Howard that would provide funding for standardized, or I'm sorry, Representative Zwiener, I think, that would create a standardized curriculum that could be taught in schools as to, here's how to use a Narcan dispenser. I mean, here's how to pinpoint fentanyl. Here's how to test for it. I will say one last thing, and that is that with respect to Narcan, I think it's important to recognize that Narcan at this point, given the situation we find ourselves in, my professional medical opinion is that it should be as accessible as AEDs, and everybody should know how to use it to the same extent that people know how to do CPR. It is that critical and that life-saving.
Representative Talarico, I asked Representative Oliverson a hardball question, so I've got to throw you a hardball question over here. And I know we have talked about not making this into about politics, but I think the reality is that politics is in everything, and it's in everything that happens under the pink dome. And so I think my question for you is, you're a Democrat from Austin. Do Democrats sometimes miss an opportunity to really have a shared common ground with Republicans sometimes? Because I know some Democrats that won't even really talk about the responsibility that Mexican drug cartels play in this fentanyl epidemic. I mean, the reality is, it is mostly coming from across the border. It's made in Mexico, and cartels love it because it's cheap, and they're going to make more profits, right? And so, I mean, do Democrats sometimes miss an opportunity just to have a set of shared facts that you guys can start from, to have fruitful partnerships like what's going on here, when some in the party won't even really talk about hey, the issue is it is the cartels, that they are.
Yeah, absolutely, and I agree with you that everything is political. Politics is just the way we all live together, and so what I talked about was partisanship, and I do think that's different than politics, because partisanship is when you revert to your team corners, right, and refuse to listen to someone because they have on a different jersey than you do. That's what we can't afford for this issue to be tainted by partisanship, and that goes both ways. Democrats, I think, have to be more willing to talk about these issues and to be more willing to come to the table with our Republican colleagues to find common ground. I can tell you, I got a little bit of pushback from folks in my party for working with Governor Abbott at that press conference, and I believe me, I disagree with Governor Abbott on many things, maybe most things. But the fact that we agree on this and it can save people's lives, that means I, as a public servant, not as a Democrat, but as a public servant, have a moral obligation to sit down at the table with him and figure out how we can save people's lives. And that should transcend the blue team and the red team. And so, we, I think, have all been talking about how do we look at root causes and how do we use evidence to craft public policy solutions that will actually work. And that means looking at causes in the United States, outside the United States. It's even, Dr. Oliverson and I were just talking on the way over here, there's some indication that marijuana legalization, a policy that I support, has had the indirect effect of pushing the cartels in this direction. It doesn't mean we shouldn't legalize marijuana, but it means that we need to be cognizant of how these different policy choices interlock and how they affect one another. And until we can do that in a serious way and not be playing silly games on cable news, whether it's Fox News or MSNBC, we're never going to get to a place where we can actually save people's lives and make our community better.
Yeah, Kate, I want to come to you because, and I just want to make really clear for the audience, the stakes that we're sort of playing with here, right? Because the reality is that policies matter, and right now the bill that Representative Oliverson is carrying would make a big difference, because currently, if you have fentanyl test strips, if you are a harm reduction group that's giving them out to people so that they don't die, you are a criminal. That is a crime. That is the current state of being here in Texas. So policies matter, and that's why the legislation is important. But Kate, I would ask you in terms of other policies that you think are perhaps concerning, because sometimes I'm looking at this thing as a reporter and saying well, what are the policies, right? And so, there are things like we don't really have adequate reporting of overdose deaths, and there's bills now to try to require that. but I know that you have some issues with that, with concerns about over-policing. And I just want to ask you about, are there concerns in terms of over-policing as we talk about how to rise to this challenge, the concern about over-policing that you and I have discussed in the past?
Yeah, thank you. First, I just wanted to note that xylazine testing strips are now being made and made available. They're new on the market in response to the need for them. And the Northeast is seeing a large number of overdose deaths related to xylazine, and we've begun to see them here. And I think right now we need legislation to encourage as many new overdose prevention tools as possible, not discourage them, even though they don't exist yet, right? When COVID happened, we didn't ban the vaccine. We encouraged it to be created, even though it didn't exist yet. And the same is true for a number of overdose prevention tools that we don't have yet, that there are folks working on. They're not quite ready yet, or maybe they don't have the funding to get them widely distributed, but we need them. We need every tool that we can get right now. And I have information on where to get xylazine testing strips. It's one of the same makers of fentanyl testing strips, so we can talk about that. So when it comes to other strategies that we need right now, so one of the things that we have supported in the past is a 911 Good Samaritan bill, which is a bill that provides protections for people who are calling 911 if they are witnessing an overdose. Protections from arrest.
Can we maybe get Kate some water?
Yes, thank you. Oh.
Nope.
Excellent. If only we had some other tools. Oh, I've got one too. Perfect. Thanks, sorry. So fear of arrest, fear of police is the #1 cited reason that people don't call for help during an overdose. We do not have a comprehensive 911 Good Samaritan law in Texas that protects everyone. We have a bill that protects somebody once every 18 months. And if you have certain felony drug convictions, you are excluded from those protections. Even if you are protected by that bill, it is complicated, confusing, and people don't, they're not going to use it. It's also a defense to prosecution, so you can still be arrested. So we'd like to see a much more comprehensive 911 Good Samaritan bill passed. And not only that, but we need to move away from penalty enhancements, punitive strategies, and really move towards the public health approaches. So the things that we know that work for people who are at high risk of overdose would be harm reduction, would be peer recovery coaching, methadone and buprenorphine are medication-assisted treatment options, right? Our waiting list for methadone in this state is egregious, and folks are at an extremely high risk of overdose while they're on a waiting list for services. So these are folks who are saying, I want help, I'm ready, and we say, wait 9 months, and we'll get you some help. That goes for detox, that goes for outpatient, inpatient. So if we want to talk about ways to address the overdose crisis, we have to go far beyond Narcan and fentanyl testing strips and really look across the continuum because people need options. There isn't a one-size-fits-all answer to this. Folks have different preferences, and they should have preferences in their treatment. I think what we do agree on, though, is that people shouldn't die, right? Every overdose is preventable. And so, again, we just need to look to the evidence, the research, and we need to talk to people who have overdosed and what they need and continue to need to stay well. If legislators were more willing to talk to the harm reduction community, they'd know that xylazine testing strips were coming out, right? But there's a breakdown in communication, I think, that I have tried to bridge the gap, but this is a huge state with lots of folks who are being impacted by this issue, and they are not in touch with their legislators because they're often trying to stay alive or keep their loved ones alive. So we need to make sure that we're making room for the people who have the solutions to offer them and to weigh in. And we have an opportunity with the opioid abatement dollars that are coming into our state and into our local communities. And we need to make sure that the process for distributing those funds and allocating those funds includes people who are at most risk of overdose, who are using drugs, who are on waiting lists, people who've been kicked out of their housing programs for using, even though they can't get into a treatment program. Those are the people that need to be in the room when we're talking about how to address the fentanyl crisis or any crisis. And unfortunately, they're discouraged from attending, sometimes due to stigma and discrimination, but often our policies are keeping people away. So I'll stop there because obviously I could go on about this piece. But we're three people sitting up here who have a whole lot of privilege and power, and there's a lot of people who I talk to every day who are at our drop-in center every day who aren't in these conversations who should be. And that's why our policies always fail, because we don't talk to the right people.
Yeah, and the Good Samaritan bill that Kate is talking about, that's been over a couple of sessions. People have tried to make changes to it, and it's still, I think we're talking about policy. It doesn't really address some of the major concerns of if you are a person who is likely to overdose, or you are a friend of a person who's likely to overdose, like. In many instances, those people are not covered, but there are bills again this session that have been proposed to amend the Good Samaritan law, including I think Representative Stephanie Click's bill to amend the Good Samaritan law, and that one has a lot of data reporting as well and addresses some of that. So people are working on it. It is just it is like with the fentanyl testing strip issue, and sometimes it takes a lot of sessions, but it also takes, I think, awareness and a bigger conversation. Representative Oliverson, I just curious to you, from your perspective broadly, what do you think are the best approaches? We've talked a lot about your bill, but what are some approaches that you would like the state to see in terms of tackling this epidemic that we're facing?
Well, that's a great question, and I think there are two things that come to mind, James. Is that number one, nothing ever happens in isolation, right? I mean, in some respects, a lot of the issues we're dealing with right now are reactions to other issues. And my colleague mentioned the marijuana legalization, and that's certainly that theory is out there and makes sense to me. But the other one I would submit to you is that on the tail end of the opioid pandemic, states, including Texas, have become very, very restrictive in terms of a person who's dealing with a chronic pain condition's ability to access pain-relieving medications. And I think the thing, when you ask, what was the wake-up call for you, Representative, and why'd you file your bill? I would say that the sort of the sentinel moment for me was when I had my friends from the Texas Pain Society, who are all chronic pain management physicians, saying, Doc, we're losing our patients to fentanyl. And they're not getting it from us. They're going out on the street because they can't get a prescription for OxyContin or for hydrocodone like they used to be able to, that was for treating their pain, because of some of the legislative barriers that we put in place to try to mitigate sort of what we would call non-therapeutic prescribing. That's sort of the technical term for legally pushing drugs onto people via a prescription, being a sort of a pill mill. The response to that has been to put a pretty significant system in place, which I support, the physician prescription monitoring program. But the thing is that it is created some hurdles for people in terms of their ability to get access to legally prescribed pain medications that they need just to have a sort of a normal quality of life. In chronic pain, we often talk about we're never going to cure your symptoms. You're always going to live with pain. But can we make it manageable enough that you can do your activities of daily living, that you can have some quality of life in spite of your pain? And so that's one issue. I think the other one, which is really very, very much bigger, and is something that I know Representative Talarico and I are always working on together, as are many, is that we really need more resources for mental health. I think we have to recognize that at its core, that addiction to drugs really is a mental health condition. And I know that we could probably talk about the fact that there are certain comorbidities that are, people have addiction, maybe self-medicating for other mental health conditions. But I think in and of itself, we have to recognize that the dependence of functioning, your desire for a substance that is going to alter your consciousness as sort of your mechanism for coping with life, generally speaking, is dysfunctional. It is not a normal way of living. It is an abnormal way of living. And we need better and more resources. I mean, look, some of these drugs are really, really hard. When you dig in and you look at the recidivism rates, the likelihood of relapse for somebody that's addicted to narcotics, I mean, is really high, especially if you don't have access to medication therapies that, you mentioned, forgot what methadone, but above and beyond that, other medications like naltrexone and Revia and some of the other medications that can sort of blunt a person's ability to experience euphoria from a drug that they're abusing. I mean, these are expensive, and treating these patients can be time-consuming. There's a fair amount of, if you don't at first succeed, keep trying again, and hopefully, you won't be a statistic. You'll have a chance to try again. But I think just because it's frustrating, just because it's expensive, just because it's time-consuming doesn't mean that we shouldn't be investing significant resources. I know enough about addiction and recovery to know that the vast majority of people who do get it and who find recovery go on to live amazing lives in recovery. It's almost like living as a shell of yourself, but if you can just get hold of recovery and it can take hold in your life and you can gain and maintain sobriety, you have no idea what blessings are in store for your life moving forward. I mean, so that to me is the biggest thing, is that I don't think that we spend enough on mental health in this state, and particularly I think that when faced with things like depression, suicide, schizophrenia, other mental health conditions, which are all important, I've always felt like substance abuse gets kicked to the curb and it sort of gets the leftovers, and it doesn't get the attention that it truly deserves. So that's something I'd like to change.
Okay, we are going to start taking audience questions. So if you want to line up over here, I just wanted to make a comment that it's, the interesting thing that Representative Oliverson was talking about in terms of, in an effort to sort of address a previous opioid epidemic, there may have been circumstances put in place where now people who use drugs cannot get them through the way that they previously got it, which is medically prescribed, and now are having to go elsewhere to get it, and that sets up a dangerous situation where they're getting it illicitly, because the reality is that the cartels, they're not making medical grade fentanyl. Like there's no real science that goes into it. It could, a pill could have a huge effect, or it could have no effect, or if you split it, one side has a little potency and the other one doesn't. Like it's just, it sets up a difficult situation. And so, and it struck me hearing that, but also just strikes me hearing from everyone, from Kate about the harm reduction efforts, from Representative Talarico about the efforts on Narcan and things like that. It's just such a broad subject, but it's something that's important to discuss because it is happening, and it I think another reason, frankly, that this has gotten so much attention is that it cuts through age, gender, wealth, tax bracket, whatever. It just cuts all the way through. So it's very important that we keep discussing, and I'll open it up to questions over here.
Good afternoon. Thank you all for being here today.
A little bit closer to the microphone, please.
Can you hear me now?
Yes, sir.
Great. So my question is for Representative Oliverson. I understand that your fentanyl test strip bill passed with overwhelming support today on the floor. Do you know where the lieutenant governor stands on your bill, and do you believe you have the votes to get it out of committee, whether it goes to the Health and Human Services or to the Criminal Justice Committee?
I have not had a chance to visit directly with the Lieutenant Governor about the bill. I know that we do have senators waiting in the wings to pick the bill up as it comes over to the Senate. I have to think that given the nature that what did we have, like 1 or 2 people vote against it today, 2? Yeah, I mean, that's huge for something like that. And you think about like a bill that maybe a session or so ago, people would say like, oh, to have that kind of turnaround, I have to think that it has just massive support. But again, I think leadership is really important, and I think having the benefit, that James and I have of our 2 bills being heavily supported by the governor, I mean, that makes a big difference. So I think it's going to pass. I think it's going to become law.
Have you talked to senators over there who support it?
Yeah. Oh, absolutely, absolutely. I know it has support among the senators.
Thank you. Next question.
Hi, good afternoon. I wanted to ask about proactive as opposed to reactive strategies. I work with a local authority and FQHC. We're very responsive to the state, to other government officials. They have a lot of hand over our funding. So we need to find strategies that are ethical but also accessible to the communities we work with while balancing not upsetting government officials. So I think between the 3 of you, you might have some ideas of how we can proactively reach community.
Okay. Do you guys understand the question? Can you ask that question one more time succinctly?
Yes. Succinctly, what's a proactive strategy that doesn't tick off government officials but can actually have an effect in the community that people can understand?
I just want to go on the record and say that I'm not easily offended or ticked off, so yeah. It takes a lot. Look, I think generally speaking, especially in the environment that you're working, from my perspective, I want to see you do everything you can, within the confines of the law, obviously. I don't want you doing anything illegal, but I want you to do everything you can to care for the people that are coming to see you and referring them to resources and things like that. There are resources out there for substance abuse and for mental health. We need a lot more, but it starts with somebody taking the time as a healthcare provider to go a little bit deeper, ask some of those questions like, how's this affecting your daily life? Have you ever missed work? Kind of like, really kind of get in there, say, you're not alone, and would you like, start that dialogue, start that conversation. To me, at least. I don't know, do y'all have some thoughts on that?
Yeah, I mean, Dr. Oliverson and I, this is our 2nd time of passing, I think, surprising bills through the Texas legislature, the insulin cap being first, and then now Narcan and fentanyl test strips. And I think it takes being a good organizer, meaning when you walk into the Capitol, always having an open hand rather than a closed fist. Always treating every person you interact with, including lawmakers and staffers, as potential allies. And that's a different mindset when you walk into an office. I know a lot of passionate activists and advocates who come up there and they kind of have an idea of who's going to be against them, who's going to be for them, based on their political party, based on previous votes, based on comments to the media or on social media. And I've found, though, that if you sit down with someone and you're vulnerable and you share a human story, you're surprised at the kind of people you can attract to your side or to your cause. And so I always tell anybody who's doing important work at the Capitol to always treat everyone as a potential ally and don't write off anyone and don't burn any bridges unnecessarily, because nothing in that building can happen by a single individual. That's how our democratic system is supposed to work. You're supposed to build a coalition of people who aren't like you, or don't have the same ideas about everything, or don't come from the same place, or share the same background. That's how this is supposed to work. And so those are the organizers that I think have been most effective. And that's, I think, a good lesson for all of us, whether you're all outside the building or whether you work inside the building like Dr. Oliverson and I do.
Thank you for your question. If you figure it out, let me know. I've got a lot of
have
public
one
health
thought.
experts who...
Kate also has a thought.
Oh, sorry,
Just
Kate.
one thought is that I think sometimes we have a duty to do what's right to keep people alive, and whether or not that's going to offend lawmakers shouldn't be the first thought on our minds. It's how to take care of our community. I would like to see more service providers and more health professionals really take a stand on this issue, because we need that leadership in our state, and we need, as a group, if we're all saying we need changes, we need authorized harm reduction programs, we need fentanyl testing strips, we need drug checking, we need funding for all these types of services, that we're much more likely to see that happen in our state. So I would say, if you need a friend or a comrade, holler at me, but don't be afraid.
Thank you.
And Representative Oliverson already said he's not easily offended, so you got that going for you. Next question.
Hi, yes. So I am a person who's directly impacted. I have, lived experience of opioid use for most of my life. Illicit opioids actually saved my life. I went through a lot of trauma growing up, and I don't think I'd be alive otherwise. And I heard a lot of conversation about, especially coming from Kate, and I want to thank you for your harm reduction work in the state, and thank both of you representatives here for supporting fentanyl test strips. But I heard some talk about, some of these practices having been around for quite some time. And I know that myself, folks that I run with, have been handing out fentanyl test strips for 6 years ago. And a lot of the harm reduction practices that are in place, I saw implemented 30 years ago, back when they were still illegal, and many of them still are. So my question is really kind of two parts. One part pertains to the people who are directly impacted by this issue, and those of us being involved in the conversation. And the next part has to do with the structural components of this issue. So, A, how do we get people with these answers that have had many of them for the last 30 years involved in these conversations to the point where there's an impact on policy, where there's an impact on attitudes, and where there's an impact on our path forward? And then B, when it comes to this attitude that we could punish our way out of this problem. So, we have these villainous drug dealers and these cartels who just want to kill everyone and poison people with fentanyl. And so if we can just bust all of them and treat drug sales as homicide, which it seems that Texas is poised to do. How did we get to this point? How did we get to the point where fentanyl is now so prevalent in the drug supply? Was it because some drug dealer decided they wanted to poison a bunch of people? Or was it something else? And then what do we do about these proposed legislations that are looking to increase sanctions as a way of discouraging the trafficking of fentanyl and other related substances?
Okay, so two questions. Let me just quickly summarize. What do we do about proposed drug-induced homicide laws?
Yes.
And then the first one was?
And how do we bring people into the table into these conversations that have had
who
these
have
practices?
lived experience?
Yes.
Well, first, I think we should recognize the ways in which that beautiful, terrible pink building down the street prevents regular folks from being involved in the process. One, most regular working people can't run for office, at least at the state legislative level here in Texas, because it doesn't pay a living wage. Two, these committee hearings tend to happen in the middle of the day when most people have to be at work or taking care of their families. So I think we need to recognize the structural barriers to folks being involved. And then to answer your second question, I honestly, and curious what the rest of the panel thinks, I think the failure of the war on drugs is part of what's shifting the thinking, at least at the state capitol here, on issues like the fentanyl crisis, because we saw how you can't arrest your way or punish your way out of this crisis. And in fact, some of those policy decisions only made the problem worse. We talked earlier that disconnection is kind of the breeding ground for addiction, right? It's like gasoline on a fire. When you break apart communities or remove people from a community, you're only going to make the problem worse, and that's what the war on drugs did. And so I do think folks are learning from our mistakes, maybe too slowly for my preference, but I do think there is a realization that that strategy was a failure and that a new approach is necessary if we're actually going to solve this problem.
Kate and Representative Oliverson, if we do this briefly, we might be able to get to one more question. But if you guys have thoughts?
Right, the punitive strategies won't work. They will only cause further harm and death. We've seen that in the evidence. I don't know what further evidence we could present. It does feel politically motivated. We're seeing drug-induced homicide laws being introduced and passed in many conservative states, even though overdose deaths have gone up in states where they've been passed. We know those laws will make people more afraid to call for help during an overdose, which will mean more people will die. And obviously, the criminal legal system is not the place that anyone gets any type of help or they don't find recovery. And although families are promised that that process might bring healing or justice, it rarely ever does. So it's a totally backwards way to address this. And all of the things we've been talking about around public health and harm reduction is really where we need to be going. And I think if we invited more folks like Aaron into the conversation, then we would be headed in that direction.
Representative Oliverson, you want to have the last word?
I think I want to hear the next question.
I think we actually may be out of time. I'm so sorry.
Okay.
Sorry, I was trying to get
so
him
we
in.
can't do it.
Yeah.
We can't do it. We can't do it.
You can do it. Okay.
Go for it.
Well, can is good. You got Robert Abbott, Fire Chief of Lake Travis Fire Rescue, Travis County 6. I want to thank the panel and Texas Tribune for today. We have 3 bills in the session right now that are trying to bridge a gap between reporting. I know reporting's always been a case. I can tell you today in real time that throughout the state there is a gap in public safety reporting. These bills would help and emphasize the need to report among all the public safety agencies, specifically fire, EMS, and law enforcement, which are administering the Narcan and saving lives, in addition to bystanders that are equipped with it. We need some nudging on these bills, and I think it would go a long way with everything that was discussed today. And I just ask you if there's anything that we're missing the mark on in a short amount of time that you could give us as public safety professionals to get this across the line to work with all the other systems you have.
Well, I just want to say that we're only, in the legislature, we're only as good as the quality of the data we rely upon. And so if we have false or misleading or inaccurate or incomplete data, we make bad decisions. So you can count me in on helping you to get, better quality reporting metrics, for these kinds of conditions through whatever you need.
Perfect.
You got my help.
And Texas Tribune will be the first to tell you how many bills are filed down there in the Capitol. So if you wouldn't just mind sharing the specific bill numbers and the authors with us, and we'll see how we can move them along.
All right. Thank you.
Okay, and with that, we are out of time. Thank you so much for joining us here and virtually. Thank you to our panelists. Thank you again to Texas Tribune members who tuned in today. Once again, a reminder that Tribune supporters keep events like this free and accessible for all. The Tribune is a nonprofit news organization, and we rely on support from folks like you. If you value our events and our journalism, join us as a member at texastribune.org/donate. Got to do the plug. Thank you, everyone.